The issue looks closely at the grant and its impact on millions of impoverished children and their caregivers in the country right now. For more, we joined in our C Point studios by Ashlinn Delaney. She's one of the leading authors of that report. Good afternoon, Ashlinn. Glad to see you could make it.
Good afternoon. Thank you very much.
Ashlinn, how has the grant benefited South Africa's children? We want to hear of the lasting impact it's made on the lives of our most vulnerable.
Well, as you mentioned, it's one of the largest poverty alleviation programs for children in the country. And it was introduced in 1998 and is now available to all children who are living in poverty and whose caregivers meet the means test. And we've seen through the research that we have done, which has involved pulling together a range of existing research, we can see there's a substantial body of research that shows that the child support grant has had a positive impact on children's nutrition and on their school attendance and also their health.
Ashlinn, 12 million South African children receive this grant. Tell us why it's become so indispensable in the first 2 years of a child's life.
So we know that in the first 2 years of a child's life, from conception through to when they turn 2, that is a really important time for child development, and that is when their brain is developing at its most rapidly. And so it's very important for children to have adequate nutrition and stimulation at that period in their lives. And the child support grant helps families to care for their children to buy sufficient food, or at least contribute to buying the food that they need at that time. And the other thing that we know is that the earlier a child gets the child support grant and the longer they receive it, the greater the impacts on the child. And so it's very important that mothers or caregivers of young children receive the grant as early as possible, because that then supports the impacts, the positive benefits of the grant.
On that note, Ashlinn, and I want to highlight this because it's something that's really underreported. This grant has helped halve the share of children living below the food poverty line from about 58% of children in 2003 to 30% in 2014. Now, it does look like, after reading the report, children living in extreme poverty have benefited the most. What are some of the other benefits of the grant?
So as I mentioned, the child support grant helps families to buy more food, and so it has had an impact on hunger rates amongst children. It's also had an impact on nutrition and growth of children, although there are other interventions that are required there as well. The evidence shows that it supports children to attend school, and there was an impact assessment in 2012 that found that those children who received the grant early and for a long period, that it may have an impact on their schooling outcomes as well. So when we look at tests of maths and reading, it looks like it has a positive impact there. And research also shows that there may be a protective effect for adolescents, so it may reduce risky behaviour amongst adolescents. So that's quite a broad range of positive benefits. Also, across Statistics South Africa has 3 different poverty lines, and we have seen a decrease across all 3 poverty lines for children, although obviously there's more that needs to be done.
It does sound like a crucial investment in a child's life and his or her future, but many of our eligible children, and there's about 1.8 million of them, are still not accessing this grant. What are some of the key barriers to access at this point, Ashlinn?
I think it's important to recognise that a lot has been done to improve the application process for the child support grant over the years. But some of the challenges that remain are things like having the correct documentation to apply for the grant. There's also some confusion about who is eligible for the grant and what the means test involves and what the income threshold is. There's also some difficulty for those in rural areas to travel to the SASA service points to apply. So there's a range of challenges along those lines.
Thank you, Ms. Delaney. That's Ashlinn Delaney, one of the leading authors of the South African Child Gauge 2016 issue, joining us from our C Point studios.